ELI 5. What does a chiropractor actually do? I'm hoping a medical professional could explain, in unbiased language, since there seems to be some animosity towards them, what exactly a chiropractor does, and how they fit into rehabilitation for patients alongside massage therapists and physical therapists. What can a chiropractor do for a patient that a physical therapist cannot? Additionally, when a chiropractor says a vertebrae is out of place or subluxated and they put it back, what exactly are they doing? No vertebrae stays completely static as they are meant to flex, especially in the neck. Saying they're putting it back in place makes no sense when it's just going to move the second you get up from the table. Physical therapist that gets asked this question at least once a week here. Here's my diplomatic answer. Chiropractic practice began in the 1800s and considers itself an evolution/variant/extension/permutation/whatever of osteopathic medicine. Essentially, in their view, the body needs to be looked at as a whole rather than individual symptoms to be treated. Chiropractors' classic theory then says that the stresses of day-to-day living, trauma, etc. will cause shifts in how your bones are aligned, which then affects blood circulation and conduction of signals by the nervous system, which will ultimately affect your global health. Therefore, by adjusting the skeleton back to its ideal form, you can restore homeostasis and the body will then naturally heal itself. Modern research has shown for a while that the force required to truly relocate bones that aren't legitimately dislocated would either be injurious to the patient or you would have to be superhuman to actually do so, particularly in the case of vertebra. Given how thick the ligaments that hold each piece together, you don't often see people spontaneously paralyze themselves because their spine fell apart like a game of Jenga. As such, you see more and more chiropractors start to hawk other natural remedy treatments that still stick to the original idea of a holistic body treatment. Not that there's anything wrong with considering a patient as a whole person in your treatment options, but when you're approaching the problem as an endless cycle of pushing joints back into position that will inevitably fall out again, as opposed to, say, helping them perform their daily tasks without pain and educating them on what they can do to be as independent as possible, is that really keeping the patient's best interests in mind? Edit. As for what is actually happening when PTs or chiros perform a joint manipulation/adjustment/thrust technique based on current evidence, all joints are sealed and filled with lubricant fluid. The techniques involve momentarily distracting the pieces from each other, creating a gas bubble from the negative pressure that results in a chemical reaction cascade, ultimately resulting in endorphins being released to the surrounding musculature, allowing them to relax, and the joint then can move more due to less restrictions from muscular tightness.